Our next speaker is Emily Evans, who is a registered nurse with over 17 years of experience working in healthcare and social services. So Emily received her Bachelor of Nursing and specialized in critical care after beginning her career in forensic psychology. She now collaborates with Sunnybrook Hospital as the Trillium Gift of Life Network organ and tissue donation coordinator there. And so we're asking Emily to give us the perspective of an organ donor coordinator as it relates to medical assistance in dying and why these cases are different.
Good afternoon, everyone. So as Andrew said, my name is Emily, and I'm a coordinator. I'm an organ and tissue donation coordinator that works with the Trillium Gift of Life Network. And I have a different, kind of a unique perspective on types of MAID and also when approaching families at end of life to see if they want the opportunity to be able to have their loved one live on through other people. So before I start, I just want to give a general overview on how organ donation happens in Ontario. So this is specific to MAID. So first what happens is a physician will confirm eligibility for MAID, and what they'll do is they'll call our head office. So our head office is going to determine whether, for one, they'll look up to see if they have a DP, so their donation preference, so if they registered their consent already, and see if there's any red flags, because we would never want to approach someone when there's no potential for donation. So what happens if it doesn't look like there's any red flags, moves on to notifying someone such as myself, and we'll set up a pre-approach plan, speak with the doctor, and see if we can speak with the patient. And then hopefully we'll move on to consent for donation, and then the MAID provision happens, and then we'll go through with death by circulatory determination, and we'll go for organ donation. So I know what you're thinking. You're thinking, okay, well, get to the point. You said that you're here to speak about MAID and how it's different from the regular donation. So, as you know, donation takes a whole village of people to be able to make this happen. So you have your MAID, or you have your doctors, you have your coroners, you have your nurses, you have your healthcare staff, but you also, when it comes to MAID, you also have your MAID provider and your coordinator that is involved as well, and most importantly, the family and the patient himself. So now you're thinking, okay, so what is different from a regular donation to a MAID patient? Well, it's the approaching first person. This is what people start to get a little nervous about. So typically when I'm approaching a family. So you're talking third person. You're talking about this particular patient that's sitting in the bed. But now you're asking me to approach first person. Well, that's kind of scary. So I'm going to talk to you a little bit about advantages of being able to talk first person. So think about the empowerment. Now, just a show of hands, and no judgments, who has registered their consent for donation? Show of hands. Wow, that's amazing. So if I were to tell you that only about 2% of everyone that raised their hands would be eligible for donation at your end of life, how would you feel? It's kind of shocking when you think about it. You have to be in the right place at the right time, mechanical ventilation with not with MAID, but that's an exception. So if you think about it, when I'm going to approach a family, or when I'm going to approach a person, first person, that sense of empowerment, knowing that you are the one that's saving lives, knowing that you are the one that's going to be able to live on through other people, how amazing would that feel? How amazing would that be to say, you know what, I know that I lost control of my body. Maybe I'm in pain. Maybe I can't do the things that I can normally do. Maybe I lost my sense of health. But you know what? I have control and I have empowerment to be able to make this decision, and nobody's going to make that decision but me. So that brings it into the control as well. So you are making that decision, and you know what? You are making this decision based on peace of mind, so your family's not able to make that decision for you. You don't have that opportunity to have your family saying, well, I don't know, maybe they did want to register, maybe they didn't want to register. Now, you guys are all amazing and you registered your consent already online, but there's a lot of people that don't even think about it. When you go to Service Ontario, it's, yeah, I'll do that later, or maybe you're just all sign up online. But peace of mind, you're knowing that you have made that decision for your family. This is a decision that you want to make, and you're the one that's going to be able to hopefully save lives at the end of your life. Another advantage is individual versus patient. When I'm talking to a family, I'm talking third person. I'm talking about this patient that I've never met before, and at the bedside, a lot of healthcare providers get to know the family, get to know even the patient a little bit. But I don't have that advantage of that. I don't have that advantage to be able to come in and say, oh, I know this person. So we'll usually start off with, I've never had the privilege to meet Jim, Bob, or Joe. So now we're going to actually get to know the person. We get to know their personality. We get to know their likes, their dislikes. And knowing exactly what they would want at end of life also brings a little bit of reassurance to not only their friends and their family, and even for coordinator comfort to be able to say, you know what, this is exactly what they want, and I'm going to make everything perfect for them. And it's also a confirmation. So healthcare team, family, maybe they were like, well, maybe they changed their mind. How do you know this is exactly what they want? Well, I'm approaching first person and I'm telling you this is exactly what they want. Maybe you're witnessing it, maybe you're not, but you know exactly what they want. So great. This is so easy. With all the advantages I just listed, why wouldn't anyone want to do this? This is so fun. However, there are a lot of challenges approaching first person as well. So as a protect mechanism, a lot of people want to protect their patient or their loved one. You know what, today's not a good day. I don't think that you should go approach. You know what, they're really going through a lot. They're just not having a good day. And we try to protect. As a healthcare team, we want to protect our patient. We want to make sure that there's nothing uncomfortable, that clean, white, crisp sheet, our patient is nice and clean. They're not bothered by anything. We just want that to happen. However, that can be a very big, difficult obstacle to overcome when I'm trying to approach because they try to protect that patient. Well, what about location? Sometimes when you're having MAID, that doesn't necessarily mean that you're in the hospital. So maybe you're at home. Maybe you don't want to go to the hospital to have MAID, and maybe this could be a huge obstacle that we have to overcome. So maybe that could be a reason, and even if you're not able to communicate, how am I going to communicate with you when you can't talk? Maybe that's the reason that you're having MAID is because you have ALS. You have an obstacle where you're not able to speak over the phone. Another obstacle that approaching first person is coordinator comfort. So I'm talking to you and I'm saying, you know what, would you want to live on through others? Would you want to save others through donation? And I'm knowing that you're going to have that MAID provision tomorrow. You feel those sense of emotions and that overwhelmment, and you know what, I'm talking to this person, and maybe I'm not that comfortable with MAID. Maybe I'm not that comfortable because of my beliefs and because of what I haven't actually gone through before. And I'm approaching this person and I'm saying, you know what, maybe I'm a little uncomfortable with this. So that can be a challenge as well. And the healthcare team, dun dun dun. Did you just say the healthcare team can be a challenge? And I know every one of you in here is like, nope, not my hospital, not me. We are great. We will do everything that we can in order to promote the best quality end-of-life care. Well, we know that this is not true. So there's a lot of obstacles that coordinators will encounter. So I'll start with one, not comfortable with MAID. So maybe it's against their religious beliefs. Maybe it's because they've never encountered MAID before. And again, it's something where a lot of people in society are uncomfortable with what they don't know and what they haven't experienced. Same thing with donation. We find as coordinators, there's a lot of healthcare teams that are uncomfortable with donation. There's a lot of nurses that have never had a donation patient before. And I'm speaking for myself. When I go to some hospitals, all the ICU knowledge goes right out the head, and they think, I don't know what to do. Again, it's a regular ICU patient. We can do this. And then we just provide the guidelines to how to properly manage a patient for donation. Or maybe they're uncomfortable with both. Another obstacle is when you're changing from healthcare providers saving your patient's life to now saving a recipient's life. So that can be a huge challenge. You're sitting there, you are saving, you're doing everything you can in order to save your patient, and all of a sudden the family comes in and says, well, I want to withdraw life support. So to switch to that transition to say, you know what, maybe I have to take some blood work, or maybe we have to do some diagnostics or something, people can say, you know what, I don't feel comfortable with that because it's all about dying with dignity. Again, we're talking about the clean white sheets. We're talking about comfort. We're talking about we don't want to do anything invasive for our patient, and your invasive might be different than my invasive, a little bit of cold jelly on the belly for an ultrasound. No, I don't want my patient to go through that because dying with dignity. We want to make sure they're pain-free, they're comfort-free, or not comfort-free, they're comfortable, and we want to do everything we can to ensure that that's going to happen. And there's also a lack of education. When people don't know, they usually will set up barriers and say, you know what, we're not going to do this without the proper education. So this is why we do it. And I know that we spoke briefly about all the different organs that we were able to procure through MAID provisions. So we've had 30 organ donors following MAID, 219 tissue donors following MAID, 64 lives were saved, and 219 lives were saved through tissue donation. So this is why we do it, and this is why we overcome the barriers and overcome any obstacles that we have, and we have to realize that approaching first person is the person's decision to make or break for donation. If they don't want to do it, that's their choice. If they want to do it, we want to provide every opportunity that we can, just like we would for spiritual care, just like we would for social work to come and speak with the family. We are providing that opportunity for organ donation as well. Thank you.